It is crucial, is it not, for any health service to allow employees to speak openly and freely about what they consider a risk to patient care. But huge amounts of money are being spent on gagging clauses and lawyers' fees to buy silence. Genuine concern is ignored, as we saw, again, in mid-Staffordshire, to protect government policy.
The sorts of issues on which I raised concerns included patient safety, it included probity, it included gross inefficiencies and wasting of public money in ways which led to avoidable loss of benefit to the local population.
Do you think there is such a thing going on whereby members of the NHS are unable to speak out for fear of retribution?
Absolutely. There's absolutely no doubt about it.
In a number of cases, I was told in no uncertain terms that I had stepped out of line, that having raised concern, it was now my job to keep quiet. I was not to raise it to publicly accountable bodies, I was not to take it anywhere else. That was it. That my duty as a manager was to the corporate team and to the corporate objectives and the targets of the day. My duties did not lie with the wider public.
So who exactly is doing the intimidating?
It's about the system being driven by the finances and not patient needs. So anybody who steps out of line with that system is brought into check, and it comes from the top. It comes from the chief executive of the NHS, who was David Nicholson, all the way down. It's part of the management consultant, and human resources are no longer there at all to protect the individual employee. They're much more there to make sure that the will of management is being carried out. And you're seeing it because the idea of complaints being brought on people and people being put on long-term gardening leave, these are all tools and mechanisms. There's an armoury of different policies that trusts actually have at their disposal.
And further up the chain of command, the imperative became shut down this awkward story. This is embarrassing, and causing embarrassment to ministers of whatever political colour was not acceptable. That was a higher order offence, if you like, than actually admitting that there was something that might be wasting public money or actually leading to harm for patients.
In fact, the system is set up to keep us at bay. So what happens is, if you alert somebody to something, you'll be passed on to an investigator or you'll be passed on to a regulator, and then the feedback that you get is, we're going to wait until the outcome of this investigation. Then months later, after a very protracted and convoluted course, which is very, very difficult to keep track of, the conclusion will be that there's no case to answer or that things have moved on.
Have you been intimidated?
Well, I've been intimidated would suggest that I have been subject to bullying. That's up to others to interpret. But I do remember when I was doing all the work on the private finance initiative, actually having the chairman of the trust phone me up at home one evening to ask me what I wanted. So that was the offer of a bribe.
I was told by the press officer of a strategic health authority that I should reflect on the fate of the late Dr. David Kelly, who was found dead in a ditch with his wrists slashed, as an example of what happens to whistleblowers, that they come to no good, that they end up suicidal, or unfortunate things happen to them. It was an overt threat.
I do know that when the UCLH Trust was signing its PFI deal and I made my objections and asked them to document it, I had no voting rights, but I was on the trust board, not one single person spoke to me as they filed out. And so I suppose what you have is a culture of silence.